So we've talked a bit about photo voice as a method of research using visual images and even ways of talking about visual images. But I also wanted to talk about some other methods that people have come up with for either gaining information from people or sharing information. And one of them is called digital storytelling. And you might be familiar with this. It's something that enables participants to combine digital multimedia elements, such as images, music, voiceovers, and video, to succinctly share a personal story or message. And they're usually very brief. They're usually about 3 to maybe 15 minutes at all. So they're not really documentaries. They're putting together these different elements into a storytelling. And you probably do it all the time with your phones, but it's something that can be done very, very systematically. So I had a chance to be a part of a digital storytelling workshop around cancer at the Alaska Native Tribal Health Consortium, and so I got to do it with community health workers who work in Alaska in their own villages, community health aides, and they were learning about cancer, and they were able to develop in the meantime their own story about cancer. And so I was able to be a part of this, and I wanted to share with you some of the processes or the procedures we went through. So there are different steps to developing a digital story. And in my workshop, we learned about them. We came together to learn about them. Then we came up with our ideas like you did in terms of what safety means to you. You had to come up with your ideas. And then we created our stories and we just sort of outlined our stories and we came together in a circle discussion to share our stories and get feedback, though that's not necessary, but it's a great part of this process. We created our scripts that we would read from, specifically to make a very succinct story. And we created these storyboards, like you see on the right side of this slide, where we decided, what kind of images or video or words or whatever would I like to have that shows what I'm saying. And those can be personal images or things that, you get off the web. So we created our scripts and our storyboards. And we gathered our materials, which would be these pictures, the music that we wanted to play, transitions that you can do. There's all these cool things that you can do. Then we recorded what we were going to say. And we put it all together in something called Windows Movie Maker. But there's so many different ways to do this. I mean, we can do it on our phones. We can do it with PowerPoint. There's so many different ways. But they used Windows Movie Maker. And then when we were done with our stories, we shared them with each other. And that's, again, a big part of it is being able to tell the story, tell your message, tell your moral, kind of like photo voice, the idea of trying to share what you've learned from your new insights about yourself or about others. And then we discussed ways we would disseminate it to others. So on Blackboard, I've given you the website for the Alaska Native Tribal Health Consortium where we did this and, their website for digital stories that have been made. But I also want to talk with you about something that I called photo maps. And this was before I came here. I was again in Florida. And I started a program called With Us. It's Women's Independence Through Health. And we were looking at universal screenings for people living with disabilities. And we developed something called photo maps where people would go through a healthcare type of visit at these were women living with physical disabilities who partnered with us, and they would take pictures throughout their visit to show us what made it easy or hard to be screened. And just to give you a little background on this study, at the time and even now, physical disability is a barrier to regular screening. And studies have found some mixed results about this, but really when we talked to women about this, they had many, many issues around going in for mammograms and going in for clinical breast exams just because of their physical disabilities. And there are barriers that women face that are similar to those faced by other women, having to do with like lack of health care or things like that, but some unique to living with disability. And we wanted to know more about this so that we could make change to help women be able to access the screenings that could save their lives. So our first research question on this project, and it was a mixed method study where we did interviews, but then we also did some photography work, was we wanted to do interviews where we asked women, where we wanted to find out if they're facing barriers and facilitators to receiving recommended breast screenings, including self-breast exams, clinical breast exams, and mammograms. And we also were looking at that perspective from their healthcare providers. What were healthcare providers finding as barriers or facilitators to referring or providing these screenings? And so at this point, we were doing these in-depth interviews, and we did them with about 30 women who identified as being women with physical disabilities and their healthcare providers. We analyzed the information using, qualitative and quantitative methods, and we'll talk more about qualitative analysis later in our course. And then we organized these factors around a theoretical framework, a social ecological framework. And so we wanted to be able to place it within something that we could actually work with a framework. And we'll talk about that more in the future as well. And then we hosted a public and interactive findings forum where we brought in the women who took part in our interviews to hear what we learned. And then also people from the healthcare community so that they could get continuing medical education credit for hearing about our findings and what the suggestions are. So what we found with the women is that while most of them had some kind of screening in their lifetime, they were not up to date with their screenings, which really put them at horrible risk for poor outcomes if they were indeed found to ever have breast cancer. So they weren't up to screenings that could detect these things early. And one person said, "I hate to have the mammograms. I've only had 3 in the last 18 years because I have a balance problem, of course, and then radiology technologists, do not understand." So here we see that there was an actual physical issue with regard to having a screening that could save a person's life. So to find out more, we had some research questions around a photography project. And we wanted to know how feasible would it be for women with physical disabilities to actually use photography to map an actual healthcare or mammogram visit and document the barriers and facilitators as they move along, so that we could literally not just describe it, but show what these facilitators and barriers are to screening, and what benefits do photo maps have as a tool of empowerment, research, and education. So this is my friend Lisa Hanold, and unfortunately she passed away a couple of years ago, but she was born with a physical disability, and but she was amazing. I mean, she was amazing, and she actually partnered with us on one of these photo maps. And what she did was she went with us to her appointment, and she had us take photos as she wanted them taken. So we were able to include her in the photos. And because she directed what the photos were, she was the photographer, even though she wasn't holding the camera. And then she recorded her comments about the photos, and we created a photo map or a digital story of her visit. And the idea was to show and tell their experiences while navigating a healthcare or mammography appointment. And this required a lot. I mean, this took a long time to get through because we were going into a place that ethically you don't take pictures. And so it required us to go through our IRB, our Institutional Review Board at the university, go through public relations. We had legal offices involved. There were so many consent forms for women who were part of the project, healthcare providers, the owners of the facilities where we went, anything. Anybody who appeared in photos needed to have a consent or assent form. There were HIPAA regulations that have to do with non-identifying information ever leaving the clinic. We needed accessible equipment, cameras that or others to help women direct their photo maps. So we couldn't find cameras that were accessible to all the women in our project because they just didn't have the strength in their hands to hold cameras. So we had to train others to help them with their cameras. and ensuring that we kept what they wanted us to take a picture of, make sure we got what they wanted out of this project. They were involved in all phases of the project in terms of development, implementation, and how we actually developed the photo maps and where they were shown. So again, the process included kind of like photo voice, but it was consent and training. Then we had their appointment where they developed their photo map. Then we debriefed with them after the photo map to find out how did the appointment go and how did it feel to take pictures. We recorded their audio over their pictures of what they wanted to say and edited those and created this movie, a digital story of their photos with their music and their narrative. And then they reviewed it again and to make sure it was what they wanted. And here's an example of the photos that went with what Lisa was saying to those photos while she went through, her digital story. So it's just like the storyboard that I just talked about in terms of the process of a digital story. Now, I have Lisa's photo map, and I will try to get that uploaded to our Blackboard. I'm working with eLearning to get it off my disc that I have for doing so. So I'm hoping I'll be able to show those to you. But if not, it's very similar to what we used, what I'm showing you in terms of digital stories from the Alaska Native Tribal Health Consortium. So that's just one story of my life using visuals. And I called it photo mapping because she mapped her way through an appointment, but really it's a digital story. So I hope you enjoy the digital stories, and I'll be back with you in a little bit.